well as to discuss some of the other activities that we're involved in at CDC. As most of you know, autism spectrum disorders are a group of developmental disorders defined by an unusual pattern in the way a person interacts with others, communicates, and behaves. And today we'll use the term autism to refer to several of the autism spectrum disorders. Symptoms of autism are typically present after the first birthday, but before the age of 3 years, and are usually lifelong. Autism is defined through observing a person's behavioral development, as there is no medical test to diagnose autism. There are unique challenges in monitoring their prevalence due to the complex nature of the spectrum of the disorders and the behavioral rather than biological criteria for diagnosis, as well as changes over time in how communities identify and serve children with autism. For more than a decade, there have been concerns about increases in the number of children identified with autism in the U.S. and around the world. And in response, CDC began monitoring the prevalence of autism in the 1990s, as Congressman Smith mentioned with the Brick Township study. This effort grew into the Autism and Developmental Disabilities Monitoring Network, or ADDM network, which was established subsequent to the passing of the Children's Health Act of 2000. And the ADDM network is funded through cooperative agreements between CDC and state health departments or their designated representatives. And now it's in its third phase of funding. Our methodology is based on the model program we developed for Metropolitan Atlanta in the late 1990s, which involves screening and abstraction of children's health and special education records in multiple data sources in the community. These include evaluation records of children receiving special education services in the area public schools, as well as children served in healthcare facilities for a defined set of behavioral conditions known to be associated with autism. Children's evaluation records are abstracted of these facilities by our project staff. They're combined from all sources into one complete record for each child, and then they're reviewed by trained clinicians to determine which children meet our autism surveillance case definition, which is based on the DSM-4 diagnostic profile. The total count of children identified as meeting the DSM-4 criteria for autism spectrum disorders is then applied to the total population count of 8-year-old children living in the defined surveillance areas during the year of study to determine what we call the identified prevalence of autism for surveillance year. Since 2000, we've completed studies for even-numbered surveillance years and focused on children who are 8 years old in these years, because studies like ours have shown that most children with autism are identified by the time they reach 8. In the current phase of our study, several sites are also monitoring autism prevalence among 4-year-olds in addition to the core 8-year-old surveillance efforts. In 2007, CDC's ADDM network published data from our first 2 surveillance years, identifying 1 in 150 children with autism in the ADDM network communities in the years 2000 and 2002. In 2009, we published data from our next 2 surveillance years, with 1 in 125 children identified with autism in 2004, and 1 in 110 children identified with autism in 2006. Our current report is based on the 2008 surveillance year, which was completed in 14 ADDM network sites. Those 14 ADDM sites are located in Alabama, Arizona, Arkansas, Colorado, Florida, Georgia, Maryland, Missouri, New Jersey, North Carolina, Pennsylvania, South Carolina, Utah, and Wisconsin. In addition to providing updated estimates of the number of children identified with autism, we report on various characteristics of these children. We also compare sites' 2008 results to their earlier estimates. Combining data from all 14 ADDM network sites participating in the 2008 surveillance year, CDC estimates that 1 in 88 children has been identified as having autism. We see an upward trend in the identified prevalence of autism in most individual ADDM network communities, as well as when we combine data from all sites. Our newest prevalence estimate marks a 23% increase during 2006 to 2008, and and a 78% increase during 2002 to 2008. Overall autism prevalence estimates vary widely across the 14 ADDM network sites, from 1 in 47 to 1 in 210. We identified approximately 1 in 54 boys and 1 in 252 girls in these communities with autism. From 2002 to 2008, the identified prevalence of autism increased 78% for all children, 82% for males, and 63% for females. Some of the increase is due to the way children are identified, diagnosed, and served in their local communities, although exactly how much is due to these factors is unknown. The prevalence ratio of approximately 4.5 to 1 for males to females has remained relatively constant over the 6-year interval shown. When stratifying by race and ethnicity, the rate of increase over time has been greatest among Hispanic children at 110%, and Black children at 91%, but identified prevalence in 2008 still remained highest among white children. These data suggest that better identification in minority groups is contributing to the overall increase, but this finding explains only part of the increase over time, as more children are being identified in all 3 groups shown here. Likewise, the rate of increase between 2002 and 2008 was highest among children without intellectual disability, or those children having IQ scores above 70. However, we continue to see increases in the identified prevalence of autism at all levels of intellectual ability. We identified an increase of 107% for children with borderline intellectual ability, or those with IQs between 71 and 85. And 96% for children with average or above average intellectual ability, children with IQ above 85, compared to an increase of just 44% for children with intellectual ability. Something important to note here is that for the first time since CDC began monitoring prevalence of children with autism, those with average to above average IQ represent the largest group. We're also exploring variation in prevalence across sites. While all ADDM sites have permission to review records at health facilities, some did not have access to children's special education records. Those sites with access to education records, or the sites with the green triangles noted here, those with access to education records continue to identify more children with autism on average. Data on intellectual ability are reported for the 7 sites having information available for at least 70% of children who met the autism case definition. When data from these 7 sites were combined, 38% of children identified with autism were classified in the range of intellectual disability, 24% in the borderline range, and 38% had IQ scores above 85. A higher proportion of females had intellectual disability compared with males, although the proportions differed significantly in only 1 site. When data from these 7 sites are combined, 46% of females had IQ scores in the range of intellectual disability compared to 37% of males. Variation in prevalence estimates across sites also appeared to be associated with improved identification among children without intellectual disability. The 2 sites with the highest proportion of children classified above the range of intellectual disability were Utah and New Jersey. Utah having 87% of the children they identified with autism having IQ above 70, and New Jersey finding 73% with IQ above 70. As we mentioned, our methods are based on behavioral descriptions, and not all children that are counted in our autism prevalence estimates have a community diagnosis of autism. Approximately 79% of all children meeting our surveillance case definition in 2008 had a documented autism classification in their records. This is the highest proportion ever reported for any ADDM network surveillance year, increasing, as you can see, from 72% in our first report. This proportion also increased over time in 7 of the 10 sites completing all 3 surveillance years. So among the children that we're identifying based on behaviors, we're also seeing an increasing proportion who are identified in the community and recognized as having autism. Most children who have autism are not diagnosed until after they reach age 4, even though many children can be identified before age 2. This slide shows 2 sets of data. The median age of earliest known diagnosis by subtype category, which ranged from 48 months for children diagnosed with autistic disorder, a more restrictive category suggesting higher severity of symptoms, 53 months for children diagnosed under the more general category of pervasive developmental disorder or a general autism spectrum disorder, and 75 months for children whose first diagnosis was Asperger's disorder, a category describing children without significant delays in language or intellectual ability. The slide also shows the distribution of these subtypes among children who had a specific diagnosis, with a relatively equal mix of children diagnosed with autistic disorder or pervasive developmental disorder, and only 9% of children diagnosed with Asperger's disorder. It's also important to note here that about 20% of these children had a different subtype diagnosed after their initial diagnosis. So we're seeing instability in these subtypes over time, and this is something that may factor into some of the updated diagnostic and statistical manual definitions of autism. Many people have asked whether the 23% increase in identified prevalence between 2006 and 2008 can be attributed to an increase in the proportion of children diagnosed under any particular subtype. When we combine data from the 11 sites that completed both the 2006 and 2008 surveillance years, there's virtually no change in the distribution of subtypes, no change in the proportion of children with information available on subtype, and no change in the median age of earliest known diagnosis under each subtype. So this is not something that's driving the 23% increase that we found over these 10 time points. As seen on the last slide, more children we identify with autism through our surveillance system have a documented autism classification records. And while the median age and distribution of autism diagnosis has not changed substantially over time, we have seen improvement in the proportion of children diagnosed by 3 years of age. In sites completing both the 2002 and 2008 surveillance year, the proportion of children diagnosed by 3 years of age increased from 12% to 18%. Clearly, this is still not where we want to be, and additional work needs to be done to increase that number. The take-home message from the 2008 report is that the identified prevalence of autism continues to rise in most of the communities we study. So there's a growing need for programs serving children with autism. We identified 1 in 88 children with autism in these communities, 1 in 54 boys, 1 in 252 girls. The identified prevalence of autism increased 23% from 2006 to 2008 and 78% from 2002 to 2008. The rate of increase was highest among Hispanic children, Black children, and children without intellectual disability. Prevalence also varied widely across sites and by sex and racial and ethnic groups. In summary, these data confirm that the estimated prevalence of autism in the ADDM network communities continues to increase, and autism continues to be an important public health concern in the United States. More children are being identified as having autism than ever before, and these are children and families that need help. With more than a decade of data on autism, the ADDM network continues to monitor prevalence and characteristics of autism and other developmental disabilities for the 2010 surveillance year. Further work is needed to evaluate multiple factors contributing to increases in estimated prevalence over time. ADDM network investigators continue to explore a broad variety of potential risk and ascertainment factors to understand differences in autism prevalence estimates between sites and over time. On a national scale, CDC's work is guiding critical autism research across the country. To talk more about our work in autism, I'm pleased to introduce and turn the discussion over to Dr. Marshall-Lynn Juergen-Alsop, developmental pediatrician and chief of the Developmental Disabilities Branch at CDC at the National Center on Birth Defects and Disabilities.